are live on Facebook and we're also live on YouTube at Love 101 FM Jamaica. Sign on, rock on, roll on, jump on, whatever you gotta do. I feel like everybody has gone through this, for body talk. Heart, broken heart syndrome, right?
Break.
Anniversary?
Hotel.
Oh. You said. Broken heart syndrome. That's what we'll be talking about today with Dr. Tahira Redwood. Now, Dr. Redwood is a highly accomplished cardiologist with an extensive educational background and work experience. She completed her medical degree in internal medicine at the University of the West Indies in Kingston, Jamaica in 2017 and went on to earn a Master of Public Health with distinction from the same institution in 2018. She also holds a Master of Science in Sports Medicine and Bachelor of Science in Medicine and Surgery, both from the University of the West Indies, as well as a Bachelor of Science in General Studies. Dr. Redwood is a member of several professional organizations, including the Canadian Cardiovascular Society, the American Heart Association, and the Society for Cardiovascular Angiography and Interventions. She's also an executive member of the Jamaica Association of Sports Medicine and the first vice president of the Jamaica Medical Doctors Association. Help me welcome everybody.
Awesome.
Dr. Tahira Redwood. Hi, doctor.
Hello.
Hi, good afternoon. How are you doing? Thank you for
We're
having me on the
good.
show today.
Oh, you're welcome. We were hoping to see your beautiful face.
Multitask.
But okay.
No
All right.
problem.
We understand. No problem. All right. So first up,
Doc, talk to us. What is broken heart syndrome?
Broken heart syndrome. Oh, that's a great question. So it's actually, I wouldn't say it's rare, but it is a common heart problem that presents like a heart attack that can damage the heart. It goes missed quite a bit because people don't recognize it, but it's usually triggered by a severe emotional event. So, like a death or a breakup. So if you ever hear of like somebody dying and then a week later the spouse dies, it's very common like that.
wow. So you just mentioned like some of the triggers. Do we have any other common triggers of broken heart syndrome?
Well, broken heart syndrome is called broken heart syndrome, but it can be triggered not only by very sad things, but also very happy things. So, really, really good news. That's more rare, but really good news in people that are predisposed to get it, of course, can also trigger it.
Wow.
Interesting.
I'd love to hear about that some more.
Yes, me too.
Yeah, the body is it's a funny thing. It's very there's lots of chemicals going on in it, and if everything is not balanced, it can have an adverse effect. And that's why you'll more see it in sad events. So that's why you'll more see it in breakups and death, because your hormones surge during those periods. You may not have the coping mechanisms to deal with those things happening. You don't have the support, the counseling, it's overwhelming. And when the body goes out in balance with hormones, it can affect almost every organ. But in this particular case, it affects the heart muscle, and it damages the heart muscle and causes heart muscle weakness. And in some cases, it can definitely cause death. Most times it can cause heart failure. And for some people, it can resolve with good support.
Wow.
Okay.
So much that you don't know.
Also, it's the weakness of the blood muscles that prevents
Heart muscle.
Heart muscles. Wow. Wow. And we all know that the heart pumps blood around the body. Can you share with us, how does broken heart syndrome affect the heart's ability to pump blood?
Oh, that's a great question. That's a great question. And she was answering it weakens the heart. So the heart is like a pump, like any kind of pump, like a water pump, it you water pump it, make the water go around the house, or you go upstairs
Mm,
if you have a two-story or something. That's what
Yes.
the heart does. It makes the blood go to the brain. It supplies the blood to go to the kidneys, liver, all over your body, so everything can work, your organs can work. So now, if that's not functioning properly, if the pump is weak, it can't
mm,
squeeze the blood to go where it needs to go. So in broken
Yes.
heart syndrome, if the muscle gets damaged and it's weak, let's say
mm.
it's working at 20%, you can imagine it's hard for the blood to reach places. You can get kidney failure, you
Yeah.
can get damage to other organs and such.
Wow,
Wow.
wow, wow, wow.
Interesting.
Is this different? Is broken heart syndrome different from a heart attack? Is it similar in any way? Can you talk to
Explode,
us?
So,
yes.
so I'll tell you the similarities first. So it can present exactly like a heart attack. So
Mm,
you can have
Wow.
chest pain. You can
Yes.
have difficulty breathing.
mm,
Some people they call it, have unfamiliar symptoms like nausea and vomiting, which you can also have in a heart attack. You can
Yes.
black
mm,
out or have severe lightheadedness. Those are usually the more common symptoms. So it's really hard to differentiate from a heart attack. And the
Right.
only way to truly differentiate it is to do something called a angiogram, which is
mm,
a study that they put a special catheter in the blood vessels in the wrist or the leg, and they
mm,
look to see if there's any blockages or coronary artery disease, and that's how we diagnose it. That's the only way to really diagnose it. And then we do an ultrasound of the heart to see how weak the muscle is, if the muscle is weak or anything like that. So those are the similarities to the heart attack. The differences to the heart attack is heart attacks are caused typically by blockage, so buildup of cholesterol, or what we call atherosclerosis in the blood vessels that supply blood to the heart
mm,
muscle directly. So
mm,
in broken heart syndrome, that's not what causing the heart muscle. It's not decreased blood flow to the heart muscle. It is just the hormones, right? In heart attacks, you have decreased blood flow because you have cholesterol building up in the blood vessels to the heart. So the
mm,
blood can't reach to the heart muscle. And that's the
mm,
difference. And they're managed, differently also.
mm.
Okay. All right.
Yes.
So I know you mentioned some of the symptoms
Right,
of a broken heart. Do we have more? So apart from you maybe feel it in your
right,
chest
right,
or
right.
difficulty breathing, do we have any other symptoms?
Yeah,
Yes.
some people can feel, pain radiating down their left arm or up their neck to their jaw, mostly on the left side. Yeah.
That's shocking.
Hello. So I could perhaps be experiencing this, and I don't know because
You
these symptoms seem very normal.
But
I
I'm so
wouldn't say they're normal if you're feeling.
Not really normal, but you're like, just I feel like a something. It's so all right.
And and I'm gonna say that is our biggest fault, as I think people,
Yes.
I won't say just Jamaicans, just all over the world. It's like you're just like you're
doctor?
over 35 and you're like, oh, this is a little thing. Check.
Oh,
Mhm.
doctor, we lost you for the first part of that. We only heard over 35.
Yes.
All right.
Yeah.
So the audio is going to come back in just a moment.
Yes. Yes.
Dr.
Yes.
Redwood, I
Mm.
think the audio is having a
Yeah.
little
Let's
broken heart syndrome thing.
we hope to connect with her again because this is very, very, very
Very
interesting.
important.
Yeah, man, interesting.
Yes,
I'm
indeed.
so happy that she was mentioning that um, these symptoms may seem normal-ish, or you may just ignore them because you're
Right.
saying, "I've never really." A little one too. It's soon gone.
And you probably say, oh, maybe I guess.
Yeah,
You can drink some tea.
and it just may be that you're experiencing either a heart attack or broken heart syndrome or something of that sort. Oh lordy.
Yes,
Well, let's
yes.
see if we connect it.
Oh, she's back,
Yes,
right.
I'm back. I'm back.
Yes, awesome. All right. We were sharing that we weren't hearing what you said before. You said age 35.
35.
Mm-hmm.
Oh,
So,
so 35 is, I'm not going to say you're going to find it written down, but definitely your chances of chest pain or shortness of breath or that little something that you're feeling that you watch for 1 week being something more severe is
Yeah.
much higher the older you get, right? So somebody in their 20s, you must still check it out, but
mm-hmm.
definitely the older you are, the more urgent it is for you to get checked out.
Got
So it
you.
mustn't like, even when we go to the gym, there's people that go to the gym and then they're like, oh, I was lifting weights and this is why I have a chest pain and they're actually having a heart attack. That's the
Wow.
minority. But yeah, so it's not, when something is abnormal, pain is an abnormal. It's a warning sign. So you
Mm,
should always get it checked up. Even if you're just going to go into a clinic, your family doctor, you should always don't ignore something because you think it's minor. right? You
Yes.
don't want to wait till you're dying. We don't want that. We
Mm-hmm.
don't want you to reach that is 10 out of 10 and at 2 a.m. you had the pain
Mm-hmm.
2 weeks ago and 2 a.m. you can't bear it and you come into the hospital. No. Go to
Mm.
your doctor as soon as you're feeling something abnormal, get it checked out.
So
Mm.
pain is a warning. It's not a normal thing. All
Right,
right.
right.
Remember,
So
get it checked out if you're
yeah.
feeling
So
pain.
well, I guess a regular heart check is it should be a part of your routine.
Right.
Oh
It
yeah.
hurt if we feel it too.
Absolutely.
Mm.
Yes.
Absolutely. Definitely the
Mm.
heart. And especially if you have, illnesses like hypertension, diabetes, or heart
Mhm.
disease runs in your family.
Mm-hmm.
You have relatives that have had heart disease, especially at a young age under 60, because, 60 is still young. Definitely you want
Yes.
to get checked out
Mm-hmm.
yearly with your heart specialist. For
Mm-hmm.
the regular person who is like, really healthy, really gym, your family doctor usually can check out everything. And, baseline tests I always recommend every year, your ECG and your executive profile blood work. Those are good, tests to do at a yearly basis.
Okay.
Mm-hmm.
ECG,
Yes.
echocardiogram.
Mm-hmm.
Yes.
Mm-hmm.
All
Mm-hmm. Mm-hmm.
right. Now, can emotional stress alone cause broken heart syndrome? Or no, you mentioned that
Right.
the
Other
gym.
things. Yeah. 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 Yeah.
No,
She did.
not gym, not gyms, stresses, emotional stresses. No,
So only
man.
emotional stress. What about
If
physical stress? Like the gym. Like maybe if you're over.
No, no, not usually. So if you're in the gym, if you have chest pain in the gym, you have to look out for a heart attack usually. That one
Heart.
doesn't usually
Heart.
trigger. Yeah, it has to be like a very overwhelming. So it can be
Okay,
just
that makes sense.
lifting weights.
Mm-hmm.
Physical stress is actually usually pretty good on you. Of course, you don't want to never go gym for about 1 year and then go into the gym tomorrow and lift 200 pounds. Then you're gonna cause problems.
Yeah.
You can cause problems like that. But typically, it's an emotional stress because it's a hormone, it's a bodily hormone thing. So even pregnancy, delivering a baby, those kind of things can trigger it.
Wow.
Wow.
Yeah.
Wow. 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 Wow.
Sure,
Uh, uh,
sure.
Interesting.
yeah. About diagnosing broken heart syndrome. Like, how normal is this? Like on a regular basis for you, doc, diagnosing someone with broken heart syndrome.
So the really good thing I want to say, it is uncommon, partly
Okay.
because most people go through a lot of stress on a daily basis. So, it's not like most people are not like, always happy every day and then get one emotional thing. People are usually always coping with things on a general basis. That's not really a good thing, but
Mm,
Right.
a lot of people have really good coping mechanisms. However, so it's pretty uncommon, but also it's uncommon because it can be missed as well. Because it can be missed because a lot of people can't afford to get the test that you need to diagnose it, like an angiogram,
okay.
or even a basic echocardiogram. There are a few people that can't afford to get those things done. So it can also be missed in quite a few people that present with it.
Mm-hmm.
Ah.
Does the heart's shape different, or you can during broken heart syndrome, or any
So
change
It broke down the middle.
yeah. It actually has a different shape, and so the
Mm,
actual scientific name for it is called takotsubo. And
okay.
takotsubo is basically a Japanese name of like a kind of vase looking thing that they catch octopus in. And the heart basically takes the shape of that vase. Right. So it's like
Wow.
it's big at the end of the heart and narrow at the neck of the heart. So basically that's the shape that it takes. And it
Oh.
basically the part that's big is basically weak. It's not squeezing the blood out. So it's
Okay.
like dilated. Yeah.
All
Oh.
right.
So it's
So
supposed to shape like a heart. So if it's shaped like a heart is a problem.
The heart
your
that we
heart's
know, actually. The
Yes.
one that we normally draw.
Yes.
yeah,
That's
it shouldn't look like the one that we draw at all. No, no, no. That would definitely be a problem.
all right. So we have a comment from one of our listeners. I'm gonna go ahead and play the voice note so you can hear. All right.
Good afternoon, people. Doctor, the first time me experience 2 mile heart attack, then it was in the night. And I get up and I start to jog. But somebody was talking about heart attack and thing, and I went and buy some aspirin. So the next day, when I feel the tightness and the pain on my back and on my hand, on my left hand, me do the jogging the first night, and the second night, me take aspirin. But the third night, we have to rush to the hospital. And right now, me having stent. Since the stent surgery, me end up get upset the other year. And then let me tell you, Doc, I was so upset that the heart rate couldn't go down. They had also make me sign a paper and stop the heart from beating and use the machine. But it didn't work out to that because my body did not shut down. So then they have to use the machine. So me no know. Me just tell them my little part.
Wow.
Wow.
Any comments, Doc?
Yes, actually, heart attack. First of all, one, if you have chest pain, do not go and jog. Very important. If you have a chest pain, especially that it wakes you up in the night, the most important thing is to go to your nearest hospital. That is the most important thing. Especially if we take so long to go, you can damage the heart muscle permanently and develop what that patient's describing. What they sound like they're describing is a arrhythmia, an irregular heartbeat that was happening to them. And this is a very dangerous heartbeat that can allow somebody to die. And that's why it's so important that you have to go to the doctor early, because it's not
Mm.
about, fixing something now. It's also
Mm-hmm.
preventing things happening in the future, right?
Mm-hmm.
Which can be very expensive and very life threatening. And what that patient talked about is getting stents, which, as I mentioned, was in heart attacks. In heart attacks, you have blockages of the vessel. So we put in a special pipe, like a little, what we call a stent, to open those blockages to allow the blood to flow to the heart. But timing
Mm-hmm.
is essential in those things. So if you don't do them quickly, it's less effective because you may have permanent damage before we can fix it. And we can't tell the permanent damage until you present later with other things. And that's called the angiogram, which we were talking before earlier about angiogram angioplasty, which
Mm-hmm.
one of the things that I do for sure.
Mm-hmm. Mm-hmm.
Mm.
Mm-hmm.
Yes.
So, how is broken heart syndrome usually diagnosed? So you just do the angiogram testing,
Mm-hmm.
or
Yeah. Yeah. So we do the angiogram and we do the ultrasound of the heart, which is the echocardiogram. And
yes?
basically the angiogram is to ensure that the what you're having is not the heart attack that we need to put a stent in, because you can't
Okay.
differentiate it. It presents the exact same way as a heart attack. Right.
Mm-hmm.
Okay.
So that's why we do the angiogram. And if we don't need to put any stents in and we do the ultrasound of the heart and we see the shape that we're talking about, the abnormal, the weakness, then it's likely Takotsubo or broken heart syndrome. Yes. And then we treat them both differently. Like one will require blood thinners and as I said, the stenting, and the other may require just certain medication to help the heart muscle get stronger.
Mm-hmm.
Okay.
Mm-hmm. Now, Doc, you shared that broken heart syndrome can be severe. Can it lead up to serious complications, such as even death?
Oh, for sure.
Mm.
Definitely. It is definitely not something to take lightly. And, I think that is one of the take homes I want, that your heart is not to be taken lightly. Chest pain, stress is not to be taken lightly. Stress is not to be taken lightly. I tell
Yes. Mm. Wow. Wow.
She
Wow.
tells people all the time, try
Stress.
not to stress.
it can affect every single organ from your yeah, stress is not to be taken lightly. So
Right.
in terms of death, it's not super common, but definitely there's a percentage, maybe about 5% of people with broken heart syndrome that might die. There's other people that will develop permanent heart failure, meaning they have the heart muscle stays weak, it doesn't get back strong, right?
Oh.
And what happens, that means it can't pump the blood around the body very well, and it
Mm-hmm.
can cause the blood to back up and leak into the water, to leak into the lungs, and they have difficulty breathing or they have leg swelling, and that's what we call heart failure. And people, you have to be on a lot of medication for that. Lots of people are in and out of hospital for that, and of course we want to avoid those kind of things. And but the great thing is, for the vast majority of persons, it does resolve completely, usually within a year.
Mm-hmm.
Okay.
Yeah.
Mm-hmm.
All right. You mentioned, getting out stents
Mm-hmm.
and also blood thinners and those things. What are the other treatment options available or usually recommended for someone with broken heart syndrome?
So stents and blood thinners are if you have a heart attack, the blockages
Oh,
in your heart,
I
coronary
missed
artery
the
disease. Yeah,
Right.
yeah, man. But don't worry, it's confusing. Everybody, it's easy to mix up because remember they present the exact same way. It presents
Yes.
like a heart attack, right? So no, for the heart weakness, there's special medication. We call them like beta blockers, ACE inhibitors. They're special type of medications that are actually used normally in a lot of people with like hypertension and stuff like that. But they've been found to also help the heart muscle contract. So remember, we said the heart muscle gets weak, and what we
Right.
want it to do is to pump the blood, which we call contraction, squeeze well. So we give those medications that help the heart to squeeze, and
Mm.
we just follow the heart up and see if the heart muscle, increases in strength over a period of time.
Mm-hmm.
All right.
Okay.
There's a question here from one of our listeners, Sister Riri again.
Like how me get a real bad fall. Can the stent be shift and cause swelling at the feet?
That's a heartbroken
No, no,
thingy.
no,
Yeah.
I guess the heart
Not,
attack.
not, not heart attack. That's what I meant to say. You know.
Right. Mm-hmm.
Yeah, oh, that's a great question. When we put in a stent in for a heart attack, it does not move at all once it's properly done. I've never seen that won't happen. Like, the people that do it in Jamaica, well, for sure up at the University Hospital and Andrews Memorial and at Hospital in Montego Bay, they're excellent doctors.
Mm.
So that would not happen if you fall. If the legs are swollen, that's usually symptoms of things like heart failure, which of course, as I mentioned before, if you get a heart attack or if you have broken heart syndrome, you can get heart failure. And that is something you need to see a cardiologist to ensure that they optimize your medication.
Mm-hmm. Mm-hmm. Wow. Thank you so much, Doc. And I'm sure this will be helpful to our listener,
Sister.
Sister Riri.
Right.
Before we wrap up, just finally just share with us what are some steps people can take to reduce their risk of developing broken heart syndrome?
Oh, that's a great question. So definitely, as I mentioned, stress, and I think we ignore it a lot because we're just like, everybody is stressed. This is just life. We're going to work, it's
Yes.
stressed,
Yes.
our coworker is stressed, children stressed, school stress, right? But no,
Mm-hmm.
stress is not a normal thing. We've just
Wow.
normalized it. So we have to
Mm.
develop
Wow.
coping mechanisms, whether it is that we see a therapist to assist us in developing the coping mechanisms, and we have to normalize this therapist, because sometimes we can't do it on our own. We can't just say, oh, this is normal, I'm in school, so I must be stressed. This is normal, I have 3 children, so I must be stressed. No, it's not normal. We have to learn to develop coping mechanisms to deal with the stress, deal with the anger that we have, the sadness that we have, the
Yes.
PTSD from crime that we have.
Mm-hmm.
There's a lot of things that causes stress. And to me, that is the most important preventative measure. And one of a really excellent thing that really helps with stress and also heart disease generally is, of course, exercising. So, of course,
Mm-hmm.
if you exercise, you're going to put yourself in a better place, even if you do get sick. A
Mm-hmm.
healthy person getting sick has a better chance of getting better and faster than an unhealthy person who gets sick.
Mm-hmm.
Wow.
Yes. Wow. So much learned today, and the importance of one, as we always say in body talk, checking in with yourself.
Yes. Yes.
And if you're experiencing anything that's abnormal at all,
Need to check it out.
just check it out. Don't take it for granted. And I love the fact that she emphasized that stress
It's not
is not a normal
thing.
thing.
Yeah.
We've just normalized it. Wow. We gotta be careful,
Yeah.
friends. Well, Doc, anything else you want to share before you go?
I just want to thank you for inviting me. I think education and public education, especially in health, is really needed. We
Yes.
have a lot of heart disease in Jamaica. And of course, I'm
Mhm.
happy to always talk on a topic. And thank you again.
Yes,
Yeah.
really
Thank you for
appreciate you.
sharing.
Yes, thank you so much. My friends. We just spoke about broken heart syndrome with Dr. Tahira Redwood, highly accomplished cardiologist.
Yes.
And she's also an executive member of the Jamaica Association of Sports Medicine and the first vice president of the Jamaica Medical Doctors Association. Thank you
Thank
so
you
much
so much,
again, Doc.
Doctor. Thanks. Yes,
Alrighty.
ma'am.
Thanks.
Yeah, no
Alright.
problem.
That's all the time we have for Body Talk today. I trust that we learned something. Just as you said, that broken heart syndrome
Mm-hmm.
and heart attack, they're similar. They have similar
Yeah. You just have to
symptoms.
be careful and just pay attention to yourself. She said something that we've always found a way to cope. Coping is okay, but
Yes.
hello, we can't just cope
Every
because
day, so
what's happening is that we are building all these stresses on top of the
stress,
stresses,
right?
and we wonder what happened to it. your heart may just be broken,
That's
and it not
true.
necessarily be because you fell out of love. It's just the stresses of life.
Yeah. I didn't even know that when you're extremely happy, that could cause. It's just so
Yeah, because it's an imbalance of like harm.
hormones, right?
Yeah,
Wow, interesting indeed.
yeah.
Well, that's what we're doing inside Body Talk, you know.
Mm-hmm.
Yeah.
Mm-hmm. We really, really hope that you were informed as
Yes.
usual. So every Monday, this is how we do it inside Alive, inside Body Talk at 2:15 p.m. Feel free to join us again every Monday. We're right here on the family station, Love
Love
101.
101.